often seen as a tropical paradise, but behind the beauty lies a growing health epidemic driven by preventable diseases. Tobacco remains one of the leading causes of preventable death worldwide, claiming 8.7 million lives each year. In the Cook Islands, nearly 1 of 4 deaths is linked to tobacco use, but the harm goes beyond health. Tobacco impacts our economy, our environment, and the well-being of families across our islands. That's why in 2004, the Cook Islands joined the global movement, becoming a member of the WHO Framework Convention on Tobacco Control and committing to a smoke-free future. This journey is more than a policy. It's about our children, our home, our people, a legacy of wisdom and care passed from one generation to the next.
Tatawa ano irunga i ako e toko matakeno. Teia tō marae te kawe te kura ki teia nei au. Tōra i te tangata. Te rauka i a rātou te marama. Te kite te whakari o te kura. O tō tāua marae teia. Teia ka tumu ia no te kuki airani.
Kia ora. The journey towards a smoke-free future for the Cook Islands didn't begin with bans or policies. It started with a vision that protecting the health of future generations was important. Over the past 2 decades, that vision has grown, shaped by community voices, national leadership, and regional partnerships. We begin this story by looking back at how this journey began and the steps that turned an idea into a national commitment.
I came into the Mitiaro right in the middle of our COVID-19 response, so I didn't have time to have a look at the health situation impacting our people. So until post-COVID, July 2022, that's when I looked at the stats, and I was surprised as to how many people in our country has been diagnosed for NCD, for non-communicable disease. And then looking across the programs that the Mitiaro has been implementing over the years, so I came to learn that it has been about 22 years now, exactly, May 2003, that's when the WHO ratified the conventions and treaties on tobacco control. And of course, the Cook Islands, as a member, also ratified that tobacco conventions and treaties as well. I believe that the Minister of Health then was the late Pedi Wawaipare. And then following the ratification of the tobacco conventions in 2003, then the Cook Islands developed an action plan in 2004. How they can ratify the conventions, because it's all about how we can reduce tobacco sales, marketing, and consumption here in the Cook Islands.
I must give credit to Dr. Daniel. I think he has a public health background. He was Secretary of Health for many, many years and served very well. There are other public health leaders that have been champions for tobacco-free Cook Islands. I think there's Dr. Tamarua, Dr. Neti Tamarua, former public health directors, including Ngāpuko Short. So many people have done this work, and in fact, it was in place before I started as Director, Public Health Community Services. The instructions in the Act Tobacco Control Act for the Cook Islands, they were quite strong in terms of identifying places that were to be tobacco free or smoke free. We had very strong health promotion teams. Some of you will recall Edwina Tangaroa, who was one of those strong advocates for this work. And they actually did the majority of the work. And for me, in my role at that time, it was to make sure we were still delivering and enforcing that act. But, over time, we get changes in the health system, changes in reforms. And so there's always been a sort of a moving, evolving change in how we've delivered on the Act and implemented the Act and enforced it as well. But I must say our predecessors have been probably the strongest advocates and instruments in getting this across the line.
Well, during my time as Secretary of Health, Minister Nandy Glassy was the Minister of Health, and he took on the Tobacco Control Initiative to heart. I think he really recognized the need for the whole of government approach to addressing the tobacco-free initiative in the Cook Islands. So I think I was very grateful that he took that stance. And hence we've seen action plans on tobacco control from his time, really focus around spreading the message to the various communities as well as to the various ministries of health to get this kind of buy-in, because he really recognized the need to engage all of government to ensure that we could carry out the plans of action in regards to tobacco control in the Cook Islands. So I think I was very grateful for that. He was always in view of having an island smoke-free by 2025. So it was a target, and he did kind of volunteer that he would be happy to see Atiu take on that role and be declared smoke-free. So I think, and he's from Atiu and his constituency, but, there are challenges. And like I said, it required a whole of government approach, a whole of community approach. And he recognized that. So I think, we knew it wasn't going to be easy tasks to achieve, but I think, paving the way incrementally, I think it's taken us to this place today where, I just heard the other day that 3 islands are now committed to a smoke-free island. So I think that's really fantastic.
Joining the WHO Framework Convention on Tobacco Control Treaty was a turning point. The Cook Islands committed to cutting smoking, protecting people from secondhand smoke, and keeping the tobacco industry out of health policy. In 2013, the Cook Islands also joined a regional goal to be tobacco-free by 2025. That commitment led to stronger laws, higher tobacco taxes, and more support to help people quit.
We became a member because part of the ratification as a member is that you need to implement those recommendations. And in 2007, then the first Tobacco Act was passed by Parliament. And a lot of the programs happened following that. And also during the time of the late Minister Nandy Glassy, the Pacific Ministers of Health also put this as an agenda item for the Pacific. That's how the Pacific Smoke-Free Islands came into force.
In 2012, the Mitiaro worked with the WHO and Australia's Health Department to review how the Cook Islands was doing with tobacco control. The message was clear. More action was needed, and the community had to be part of it. That same year, the first Tobacco Control Action Plan was launched. It focused on better laws, stronger enforcement, and more support to help people quit smoking.
There were some things that were not in the previous 2007 tobacco legislation, so we identified some of the key indicates issues that needed to be included in, hence the review in 2016. We did it in a way that we wanted to go individually to stakeholders. More focus group in individually, not bringing them together, but we went to them individually. We went to the Rarotongan, we went to the CITC office, we went to the justice, we went to the education office. And then when we gathered all our notes, it was put together by the lawyer, everything, and it was sent back to them for their further comments too. Knowing all these things that people also are opposed to it, the reason why, and you can see some of the, how the people approach it in agreeing or not agreeing. Some are looking at the health impacts of the people, or take it as a personal. Some look at their economic value, the benefits in getting out of it. So we were so marveled over how the different perspective of response from each the stakeholders.
Since 2003 up to now, again, the Tobacco Act was amended, as we are all aware of, last year, 2024, and some new measures has been introduced in the new Act. And then today, this month, exactly May, by end of May, so all those who have been issued with license to sell tobacco here in the Cook Islands, with particularly in reference to these 4 islands, all those licenses will expire by the end of the month, by this month of May. So there's been great support from the leaders on these 4 islands, especially from the traditional chiefs, the Religious Advisory Council, the members of Parliament, and the Rongomana and parents on these 4 islands, agreeing for their island to go smoke-free by end of this month, May 2025.
I recall having a conversation with our current Komaiti, Papa Travel To'u, and talking to him about this and saying, Mitiaro can actually do this. I have Mitiaro roots, and I thought small population, captured population, close to Rarotonga, potentially, we have the ability to do this. In saying that he was fully behind this initiative. And then, of course, our new Minister of Health at that time was the Minister Va'inetuta Rose, Loki Brown, and she expanded this to include Ngaputoro. And that year, we went to visit the 3 islands. We had our minister and we had our Komaiti, and it was fantastic. The reception from our island councils, our island communities was just fantastic. And we were actually, if we look back at the numbers at that time, the numbers of people that were smoking at that time, and we knew we would have to come and support those that were smoking to quit and provide the rationale for why and etc. We were actually on track to achieve our mark of 2025, which is this year, to be tobacco free.
Wa turu pakario te rera mano. Wapai mai te rera manako kurato i tō tātou uieri. Uina ki rātou ko ora i te tātaka maruru i te opera i te tumanako, i te paruru, i te turuturu, i te manokonoko o te pae rapakaumu. Kia akatupu i rā te, ko i te rea tātou rira, ko tomo mai tō tātou minita o, ko ia a Rose Brown. Ko akarongo te manokonoko. Ko inangaro ki akatupu ia no ngā puturu. Are no Mitiaro no ngā puturu. Ko turu katoa te rira ki ara kapiti te ia manokonoko ki a tuku ia te karere kirunga te au ino e toru.
Programs such as this, it is a big challenge. How do we convince people who are smoking to agree to this initiative? Because it's impinging on the rights of the people, getting the support of the people on the island with this type of initiative. To me, were the 2 main challenges that I thought that we have to encounter and see how we can be able to rise above it. But to my surprise, when we went to these 4 islands, even those who were smoking, because what we did was we presented the data. Data in reference to the number of non-communicable diseases here in the Cook Islands, because when vaping was available here in the Cook Islands, children as young as 6 and 7-year-olds were vaping. So this data was concerning. Was so concerning to the parents and even to the leaders of these 4 islands, which made it very easy for the parents and the leaders to agree for these 4 islands to go smoke-free by 2025. But the passage of the Tobacco Amendments Act, the law, of course, supported the banning of vaping by our Cook Islands residents, which is a very good step forward for our people and also for our children especially. But it doesn't stop anyone smoking on the island. Those who continue to smoke are free to do that, but there will be no selling of tobaccos on these 4 islands. So I guess we were able to overcome those challenges, and we are grateful that the leaders of these 4 islands and the parents and the community has been very supportive to the initiative.
As you've seen, it's taken years of effort, commitment, and key milestones to arrive here in 2025. The journey to today was paved over time through global agreements, national legislation, public health action, and the guidance of cultural and spiritual leaders. With 4 islands leading the way and a nation standing behind them, this movement is only just the beginning.